Yes.
Slides. Okay, perfect, perfect. Well, thank you again for inviting me to talk a little bit about how to approach genetic testing with your provider. So there is a little bit of overlap overall. Again, highlighting the importance of a lot of this discussion that's happened throughout today. But hopefully, we can kind of walk through on ways to approach. So the main goal of the next uh, 10 minutes or so is to really recognize that genetic testing is an option for either you or a loved one's care and how to approach that conversation with your healthcare provider. So overall, what we'll cover today is we won't spend too much time or really much time at all on what is genetic testing, but why does it matter for kidney disease as a whole, preparing for that conversation, and then during and after your visit. So, as an example, let's meet Tara. So maybe we can identify with Tara, or maybe know somebody who has a similar situation. So Tara is a 28-year-old woman who loves music and creating portraitures. She is actively involved in her 5-year-old son's school chaperoning trips and volunteering to assist with other school activities. Tara routinely follows up with her primary care provider and receives positive feedback about her health. But on her most recent visit, she recently underwent her routine blood testing and was found to have concern for chronic kidney disease. She's referred to a kidney specialist to investigate further. So, like many, she's worried about what this could mean. Uh, Often it's left pretty wide open. So, the first thing I want to talk a little bit about is just preparing ourselves for the conversation and the appointment. What do we do beforehand? So first, let's make sure we have our medical records, whether it's us within the health system. That way, the provider we're seeing is able to review and have all that information available. Again, that's something that we may not be able to get or know what to provide, but it is something that we would request our primary care doc or other provider to help supply this information. Gather the family history and note those who have kidney disease, who are on dialysis, who's had a transplant, high blood pressure, diabetes, and ideally 3 generations is as best as possible. But again, really think outside as well. We may not think that joint pain is something relevant, but it's something that is very pertinent to some of these genetic conditions that are related to the kidneys and within this organization itself. So even if it doesn't seem like it might be relevant, it's still important to try and gather that information and include that in the discussion going forward. Write down your questions. It may not be more than 1 or 2 questions. It may be 50 questions. Really, we really want you to take that initiative and bring to the appointment what you value most. Again, it's okay if we rehearse the questions ahead of time. It allows us to, as a patient and even a provider, to get where we're really coming from with our concerns or our questions. And then bring a support individual, whether it's a friend or a family member, somebody who can help remember some of that information, ask questions that you rehearsed beforehand, and even provide emotional support. Now, you don't have to have all the answers. It's okay. Even a partial history or some partial answers, whatever time you spent preparing is good enough. So we're going to continue on Tara's journey. After her recent news, she meets with her friends and family for support and talks about her new results. She learns that she had an aunt who was previously passed away, required dialysis at an early age, but doesn't know much else. One of her friends mentioned the idea of genetic testing as an advertisement was seen when she was taking a family member herself to a recent appointment. So, why does genetic testing matter? Okay. So, when we are talking about kidney disease and genetic kidney disease in particular, up to 30% of patients who have chronic kidney disease may be of a genetic cause. 50% of patients who have already had a biopsy or already had a diagnosis may be altered or reclassified to some degree based on a genetic testing. And then a pretty powerful statistic here is 90% of patients who have had genetic testing can see a change in their management after a genetic diagnosis. That could include something as far as medications starting or stopping, could be in results to family members care and involved with our family history, as well as transplantation. So again, just highlighting some of the important factors that have already been mentioned throughout today's talks. Some common genetic diseases. I know ADTKD is one that's near and dear to our hearts here, but there's a wide range from of genetic kidney diseases that are out there that maybe not for ourselves, but maybe we can help advocate for one of our friends or other family members in those conversations. So, when would you consider genetic testing from a kidney perspective? Family history, unexplained kidney disease without a clear cause, early onset, other concerns for or genetic signs. Are kidney functions declining fairly rapidly, or others that have maybe a higher risk that we've noted throughout? So, continuing Tara's journey, the day of the appointment comes. Tara's nervous, but she's prepared because of the advice that her friends and family ahead of her visit. So, an important question is, how can I make the most out of my appointment? Be open and honest. Share your concerns. Really have an open discussion with your provider so that way they can see the whole picture. If you don't understand anything that I'm saying or your provider saying, please ask for clarification. It's not that we don't want you to understand. It's oftentimes we just need to find the right way to communicate what we're trying to say. So please tell us to take a moment to pause, just ask for clarification. Again, highlighting those important questions first. Use your support person and take notes or record the visit if the provider allows. So over the next couple slides, I have listed some key questions to ask your provider. I'm not going to read through all of these as a lot of these have already been discussed. So big ones that I just want to touch on are just asking something simple as, could my kidney disease have a genetic cause? Talking a little bit about that process of what does testing a genetic test look like? And then how is it covered? What were we going to do with the results? And what about genetic counselors? Before, after, during, all these are important questions we can ask. Again, similarly, should we talk about family members? And then what if no treatments are available? Remember, there's no bad questions if your provider, uh, there are no bad questions. If your provider uses a word you don't know, again, please just take that moment to say, hey, can I have some clarification, please? And overall, some good ways to start that conversation because your provider may not bring that up. It's okay if you are the one to initiate that conversation. I've been reading about the genetic testing for kidney disease. Is this an opportunity to help understand my condition a little bit better? Several patients in my family have kidney disease. Could it be genetic? Would it impact my overall care? And if you think testing is appropriate, are you able to order it for me or refer me to somebody who might be able to help me through that conversation, whether it's appropriate or not? Some common barriers that we talk about. My provider hasn't mentioned it. As I said, it's okay. It's all right to bring it up yourself. Providers appreciate an engaged patient. I'm worried about the cost. Many of these tests are covered by insurances. There are multiple companies out there that offer assistance. I'm scared of what the results might show, but the more we know, the more it is empowering. Again, it's part of the conversation that we want to have during that visit of what's important to you and what it means for your care overall, as well as your family. Okay. And then an important thing here, my provider said that testing isn't needed. Well, ask why. And then we'll talk into a couple of other questions to ask from there. So if my provider says no or it's not needed, don't be discouraged. You still have options. Again, ask for the reasoning. Understand their perspective on why or why not they don't think it's an appropriate test. Request a referral for somebody who maybe sees genetic testing or a genetic specialist a little more commonly. I do have some providers that are within my group in the local region that don't understand genetic testing as a whole and often refer to me to help out within that process. So maybe we have a provider within that bucket. Seek a second opinion. It's okay to ask for another opinion. It is your health. You want to be the one to get all the right information or all the information that's available for you to make the best decision. And then our advocacy groups. So the Rare Kidney Disease Foundation, as well as numerous others, are really helpful in empowering you and the community to help within these discussions. Important to know after your visit, when are we following up? Is it going to be a few months, few weeks? How are we going to go through that? Discuss the results with your team. Are you going to give me a call? Are we going to come meet together and talk about it in person? Seek genetic counseling. Again, before, during, and after, all are appropriate times. Genetic counseling is our friend. Consider your family and talking to your family when we feel comfortable about sharing that diagnosis or something we've come across about getting tested and then connecting with our patient organizations. So although we didn't come to an exact diagnosis for Tara's story, we noticed that she has CKD can appear unexpectedly even in healthy young patients. Family history is important, and patients themselves can initiate these conversations. So, highlighting some key takeaways, genetic testing, have that open conversation with your provider. Genetic counselors are our allies and often can help find the appropriate way in those next steps. And then be open to sharing with your provider and family. So, on that note, your voice matters. You deserve answers. Start the conversation with your provider today.
Thank you, Jacob. That was a really informative talk.